This is a patient who's presenting at a relatively young age of 61 with a very high-risk situation. He's got symptomatic disease, lower urinary tract symptoms. He's got a large prostate with a high Gleason score. He's got multiple sites of bone metastasis. We've known for a long time that hormonal therapy is going to be very effective in the beginning in sort of putting this all into a remission, if we can use that term. But ultimately, patients do progress, and this is a person who's at very high risk ultimately for mortality from his prostate cancer. We now know over the last couple of years from a couple of very pivotal studies that the early integration of chemotherapy is likely to prolong survival by quite a significant margin. Chemotherapy compared to no chemotherapy in a setting like this reduces the risk of death by about 40%. So that's quite a significant reduction in the long-term hazard of this, and the survival benefits for a population treated with chemotherapy extend well beyond a year. So this is really an important consideration for this patient. He has type 2 diabetes, and that's a consideration, but I think that it wouldn't prevent me from using chemotherapy in this setting. So the short answer is to the question, yes, chemotherapy is a very important clinical choice for this patient, which is now supported by two very large randomized trials, one in the UK and one in the US, which demonstrated parallel survival benefits.